like to say thank you. It's really a great partnership between Blue Cross and this great organization. Second, I know as David had mentioned that this has been such a weird and strange, unexpected year for all of us. We're all kind of learning as we're going. You know, I hope everyone has been able to stay safe and get through these circumstances, and hopefully we're closer to the end of this thing and can get back to normal. So as we get going here, just want to go over just a few points bookkeeping wise for the DOI. This is what I need to make mention to you. So this is the CE course number we're going to be going over. Topic of the course is Medicare and You. Of course, I know that's kind of a play on words because that's the book everyone receives when they turn 65. So just wanted to use that kind of a play on words. But I will get a record for everyone that's in attendance for the class that will be sent to me behind the scenes. We'll get in for processing as quick as we can. Just a guess from teaching a few of these classes before that probably going to be looking at maybe mid-October, November 1st before that pops up. So in case you need this 1 hour to get your CE certification done, it's probably going to be a few week delay to get that on there. But I promise you will get credit for it, and we'll get that in as quick as we can for you.
Hey, Matt, just real quick, can you flip your screen to do a full screen rather than the notes page? Just hit the display setting on there.
Display setting.
Should be the one right next to it. Yep, that one. And then switch the, swap the presenter and slide. There we go. Perfect. Thank you so much.
There we go. So you're not reading my note page. Yeah.
Thank you.
Yeah, sorry about that, Artem. So as we continue to go forward here, so when we look at this this outline for today, we're going to kind of be taking a look at a few different topics here. We're starting off with kind of like a 101 level look at Medicare. I tried to set this up so we'll lay some groundwork for what Medicare is, how it's going to work, what the different parts are as we go through. So some of this will be a review. I know quite a few of you already work in this market, so this will be a review. But for folks that are new to the industry, it's very important to lay some groundwork for what we're talking about. Now, the key part today that I want to mention is the key role that agents play. I know it was promoted in the material that was sent out to everybody today. But really want to take a look and really be sure that as agents that we are being able to help people through this very critical time period of enrolling in Medicare as they get set up for retirement. It's something I'm very passionate about, and for those of you that know me, I think Medicare is the #1 choice that people make regarding health insurance in their life that has the most effect on their lives. So as you work for a company, you get the group insurance. You know, if you are, are in the individual market, you get individual. But really, once you select your retirement plan, you're kind of locked in. It's not as easy to move around. So as agents, it's very important for us all to really play a key role in being able to help them. So we're going to definitely discuss that. Third, we're going to talk about updates to Medicare. We know there are some changes this year, January 1st with MACRA. Including changes on Plan F, and then talk a little bit about future changes to the industry. And lastly, I try to keep this as neutral as I can. I do work for Blue Cross. We are a sponsor. I'm proud to work for them. They're a great company. But I am trying to just keep this educational. I'm not trying to really do a huge promotion onto my company, but I do want to talk about a couple of things upcoming with Blue Cross Blue Shield, just that we have coming up for 2021. So, and for open enrollment. So all that being said, let's get going here. So the first question here, what is Medicare? So I'm going to read this to you, and then we'll talk about this for just a little bit. So this is the definition. Medicare is a federal health care program that was established under the Social Security Administration Act of 1965. This program provides hospital and medical insurance to elderly, 65 years of age and older, and disabled, qualified disabilities, end-stage renal disease, etc., of individuals. So when we talk about Medicare, the program that we know today was established in 1965. So you think about it, it has been with us for quite a while. It's undergone many changes. It's gone through many different setups. But the bottom line is, if you turn 65, this is something that you qualify for if you've worked enough time. So first question here, as we go to our first polling question. So Artem, if you see that. So it says here, and please, we got 3 of these questions, and I promise they're not hard and they're not graded. So how many quarters must you work to qualify for Medicare? Is it 10 quarters, 20 quarters, 30 quarters, or 40 quarters? So I'll give you just 45 seconds to a minute to answer these questions here.
And as we're waiting right now, about half the people have responded, and it seems like 40 is the general consensus here. We've got a few 10s, a few 30s.
Well, excellent.
About 65% in right now. Remember, everybody, you got to answer all these questions to prove that you were here. That's one way that we do track attendance for this course.
And hopefully I'm going to try and keep this entertaining enough where you'll be trying to pay attention. So if not, well, just take the time to drink some more coffee. So.
So the general consensus, it seems like right now we're sitting at about 75% people have answered, and 84% are saying D, which is
okay. Well, very good. We can go ahead and move forward then.
All right.
All right, so this was not a trick question. So the answer is 40 quarters, which is equivalent to 10 years. So once you work 10 years, you do qualify for Medicare Part A. So very good. Sounds like a majority of people knew that, so that's very good. It was not a trick question, I promise. So when we look at what Medicare does and how it works, now this is the original portion that was set up in 1965. This is the first portion that went into effect, and that's Medicare Part A. So this provides hospital benefits such as inpatient hospital care, skilled nursing facility, home care services, hospitalization, even hospice care, all falls under Part A. So Part A, again, these are your hospital benefits. So the way I think and remember this is just, Part A, you go into the hospital, you're going to be staying overnight. Then that's where Part A comes into play. So again, we probably all know this, but just as a review, to get us all on the same page here, Part A provides your hospital benefits. Now then, what about Part B? So Part B offers coverage to help cover the cost of physician services. So this is the coverage that happens when you go see your doctor. So go see your PCP physician. This is where this would jump in and pay. We're going to talk about Part B at length here because there is I don't want to say at length, but we're going to talk to it a little bit because there is some factors with Part B to really consider. So these would be services received in a physician's office. This could be a specialist visit. It can even count toward services received at home. So that's something to keep in mind. We know a lot more services right now are being rendered at home, especially since COVID has started. So it's very important to keep this in mind and keep straight that Part B is what refers to physician services. So again, just as a review, A, hospital, B, physician services, seeing your doctor. So Medicare Part B is a voluntary program. So nearly all beneficiaries enroll in Part B. So basically most people, if you're getting Part A, do enroll in Part B. I don't know the specific percentage on it, but the percentage is very high that happens. Now this is an interesting note, is that the premiums that beneficiaries pay for coverage provide the majority of funding. So in other words, if you look on your paycheck and you see that Medicare number come out for taxes on your check that you pay in every year, that's how you get it after 10 quarters or after 40 quarters. Well, the premiums actually for Part B are actually come in through the actual funding directly for Part B. I thought that was an interesting point to make. And secondly, if the beneficiary does receive Social Security benefits, Part B will be deducted from his or her benefits each month. So again, this is not a situation where when 99% of the cases somebody's not writing a check out for Part B, it's actually just taken out of their Social Security check before it's deposited in their account. So it is something that someone actively has to do to enroll in this program. So we'll talk about that in a little bit later, but they do have to contact the Social Security Administration office to sign up for this. Now, in times past, you could go right in and sit down and talk to somebody and enroll that way. But since COVID outbreak, we see a lot more people calling in over the phone and also doing it right through their online system. So just a couple points to mention there. So secondly, I know this is kind of probably a little bit blurry on your screen, but this is the actual chart that is used to figure what your Part B premiums are supposed to be. Now this is taken right from the Medicare.gov site. This is what's on there, and this is the most current one we have. And just a side note, I combed through the last couple of days and really was thinking, with open enrollment so close to being upon us, that there's probably an updated chart for 2021, but that I could not find, has not been out there. So if it's posted since yesterday, I apologize, but this is the current one for right now. Now, a couple of things to notice on this. So if you look at the top line there, that's the most common income level people are at, and generally they're going to pay $144.60 per month. But if, as you look down that list, as you continue down in the middle section there, as income goes up, the Part B premium goes up as well. So this sometimes can lead to confusion, especially as we're sitting there, especially if you're working, also trying to set them up for retirement, working with their financial planning, and so on, trying to understand what their health insurance cost is going to be. Part B can vary a little bit, so we need to be sure to take a look at this. The second part of this, if you take a look at there, is it says if your yearly income in 2018 for what you pay in 2020. So this chart actually runs on a 2-year curve behind. So that's something else to keep in mind as you move forward. So just want everyone to be aware of this. Sometimes there's confusion. It's not everyone gets to pay $144.60, but it does vary. And depending on how much somebody earned a couple years before they retire could influence what their Part B is. So again, just something else to keep in mind on there. So as we get through Part B, we know we talked about that quite extensively. Now we get to, just by working by letters here, now we get to Part C. So Part C is really tied in quite heavily with Part D. So Part C is your Medicare Advantage program. And that actually combines your Part A, which is your hospitals, Part B, which is your doctor visits, and usually includes Part D. And now D is very easy to remember because D, drugs, stands for your prescription drug coverage. So Part C combines all three of those parts, A, B, and D, and then combines it into one plan called Medicare Advantage. So we know quite a few of you probably sell that product right now, but really this gets us into the meat of our conversation today of what we're going to be talking about is these choices between how to supply someone with what they need for their insurance needs during retirement. They can either go to a GAP plan, as you see on the left side of the screen there, which is a Medicare Supplement insurance program. What that does is it works in coordination with Medicare to give people the coverage they need. Whereas Medicare combines those, or Medicare Advantage, I'm sorry, combines those and puts them all together. So that's kind of the two ratios we are going with there. So you've got these underlying letters. So I think of it like this. So I'm hoping you can see this on the screen. So as a puzzle piece, let's say you've got 3 pieces together with your A, your B, and your D, and that's provided, and that's the coverage that you need in your retirement years. Well, when you talk about a Med Advantage or a Medicare Supplement, well, it's like a puzzle piece. They fit right together to provide the coverage that the people that your members need and your clients need to be properly covered throughout retirement. So when those fit together, we're providing good service for them. So we look here, this again, just as a review. So we're looking at Part A again is hospital. Part B is your outpatient services, including doctor visits. Part D is your prescription drug coverage, and then Part C combines those three into a Medicare Advantage plan. So as we talk a little bit more about it, that just gives us the groundwork. And I know this is a review for most of you, and but it gives us kind of a groundwork to start from for what a client is looking for as they near that Medicare age. So this is the next poll question we have here for you. Hopefully I didn't bore you to death through those talking about the A through D parts there, but true or false, everyone pays the same for Medicare Part B. I know we just talked about it, but I just want to be sure I haven't put you to sleep already.
And the results are slowly coming in. It looks like we've got 92% of people are saying false, and we've got about 64% of the people have responded.
Okay.
So
I'll give everybody another 25 seconds or so to get those in. And again, on a side note, normally when we teach these classes in person, I'm able to actually have some interaction where we can talk back and forth and talk through some of these points. But in the virtual world, this is our new way of doing it. We got to have this interaction through clicking on a poll question. So please do so.
All right, I've got about 69 people responded so far, and 93% say false.
Well, very good. Well, for those holding out, pay attention to what the popular answer is.
And if you don't need CEs, you obviously don't need to vote. But and if for some reason you're not seeing the polling questions, feel free to put it in the chat. I will save the chat later and add it to your participant guide so we have that. So with that, Matt, I'm going to close off the polling, and 72%, 73%, wow, just last minute polls coming in. All right, we're going to close it off now.
Fantastic. Well, fantastic. Well, as we talked about there, as those wheels are turning in that little guy's head there, yeah, the answer is that that is false. There is a variance in what everyone pays, and it's based upon income. So very good. Glad everyone got that correct. That's one of the common questions that comes up is what is my Part B going to be? So that's very good to go over that. So here's kind of the meat of what I wanted to talk about today, and that is the key role agents play in helping members and being able to decide what coverage they need throughout their retirement years. So let's delve into this a little bit and see how and what we can discern from this. And I'll share a few stories about my family as well, because we directly have an impact on this. In fact, I will say on a side note here, you know, we know the numbers where 10,000 people a day are turning 65 every day, and that number actually continues to go up right now. So we're definitely in that situation. I'm 44. My parents fit right into that category. My dad's 74. My mom is 69. So we are definitely in that category where this has been something near and dear and close to my heart in recent years, as we've had to get them set up. And no doubt, many of us that work in the industry, we all have friends and family, or that's grandparents or parents or our spouses, or you yourself are all on one of these programs. So we know as agents working in this field that it is a situation and a decision that needs to be made that really does affect people, because most of us have people that are directly affected by this. So as we talk about this here, original Medicare does not cover everything. So again, remember that puzzle piece that kind of leaves something else to fit in the gaps around what original Medicare covers. So original Medicare does pay a share, but then also the customer has to pay a share. Those could be either deductibles, co-insurance, co-payments, or monthly premiums. So as we take a look at that, you know, there's many different aspects that could be. So for instance, on the Part A side, roughly speaking, it pays, Medicare is going to pay 80% of the coverage, 20% be left over for the member to pay. So if we think about $1,000 claim, okay, well that's $200 for a member. Okay, well that doesn't sound too bad. Well, then you go up to $10,000. Okay, well now we're talking a little bit more money. So all of a sudden now we've got maybe $2,000 exposure for the member. Well, what happens if it's something serious where it gets even more involved than that, where you're talking about a claim of $100,000? Does somebody that is trying to live out their retirement years on the money they've saved up, or perhaps in residual income coming in, do they have $20,000 that they could repeatedly pay out for a service? Well, that's where it becomes very important as agents that we discuss them to show them their actual exposure to what they are looking at. So when we talk about options with folks, this is where we really need to take a careful examination of what we are providing to them, what their situation is that they need help with. So a study came out a couple of years ago that the average person in retirement is going to face medical claim cost, so medical expenses during their retirement, of around $250,000 per person. So you think about a married couple that's 65 years plus, that you actually double that. That's actually $500,000 they're going to be looking at in a medical cost during the course of their retirement. So we obviously need to alleviate that. For those of you that work on the side where we are trying to help folks with retirement planning, whether you work in annuities or life insurance or whatever the case may be, they're trying to figure out how to finance their retirement years. We definitely need to take a look at what we're going to do to cover their medical expenses, because that could obviously lead to some serious pain for those folks during those years if it's not taken care of. And there's really two choices we have on this. We mentioned it a little bit before. So you've got either a Medicare Supplement or you've got a Medicare Advantage. Remember, Medicare Advantage is Part C. So they're kind of that's your two choices to help folks in this situation. So there's a time and place for either of them, depending on the person. So with a Medicare supplement, it provides things such as a fixed cost, out-of-pocket control, stability. It uses the Medicare doctor network and gives you a variety of Part D options. So when you look at your Part D options, you can go with many different companies when you're on a supplement. With the Med Advantage, one of the advantages is, not to use a play on words there, but is the lower premium. So that actually does help very much for some people budgeting when there's a lower premium per month. It works very similar to what people are familiar with either a group or individual plan, with having a network and being able to see a PCP physician and so on. It does follow a specific network, again, similar to what folks are already used to. And in most cases, Part D is included. So when we sit down and talk to these folks, we just need to figure out what is the best way to address their needs and concerns. And I look at it this way, or an easy way to remember, is that I look at a Medicare supplement and a Medicare Advantage is that one you're going to pay up front and one you're going to pay on the back end. We know the costs are going to be there. Remember that $250,000 a person, we know there's going to be exposure there. So it's a matter of how we're going to cover it. So with the Medicare supplement, you're kind of paying up front to get the coverage that you need. Whereas Med Advantage, you may have a lower premium, but you might pay on the back end a little bit more for actual claims. So we'll talk about more of that as we go here. So let's take a look at the first section. Then we're going to take a look at Medicare supplements and kind of break this down just a little bit more for you. So we talked about a fixed cost. Well, this is really budget control on medical expenses. So in other words, you're paying upfront for the coverage that you need, and you know exactly what is going to be covered. In fact, we'll look at an example in just a moment of what this can look like. But it really allows a person to know that, okay, if I set aside a certain amount of money, I know how much money I'm going to spend out of pocket. So you're paying upfront for the coverage that you need. The second bullet point there says select your letter. So we know A through N, you know, the different products that are on the market, though a couple of them kind of faded away now, but you select the letter that you want, which comes with those coverages that are needed. Stability, CMS does control the market, so they do say what each one of those letters has to cover. So that does provide stability in the marketplace for what a member is getting. So I'm going to use my first example here and talk about my mother. So in my family, my mom and dad, again, my dad's 74, my mom is 69. My mom has actually got a very serious kidney condition. She actually just got a kidney transplant actually about a month ago. So hooray. Appreciate that. So that was very good for her. But I put her, when she turned 65, being that I work for Blue Cross, I put her on a Blue Cross Plan F. For me, it was very important to put her, because of her health condition, we needed as a family to have a fixed cost budget solution for what she's been going through. So if anyone's had a family member on kidney dialysis, that by itself can be upwards of $70, $80, $90, $100,000 a month just in dialysis charges on there. So for her situation, having her on a fixed cost plan, like a Plan F, where we knew exactly what she was going to have, was very, very important. And that's what we wanted to set her up on. So because of that, she is able to have excellent care. She's had just a minimum amount of exposure for deductibles and so on that are on there, but it's allowed her to really have what she needs. So we take a look at the stability. She's definitely appreciated that. We've seen that in work, you know, or in play as she's had that is so good for her. Secondary, with the Medicare doctor network, you know, that Medicare supplement plan is good anywhere where Medicare is taken. So it gives some freedom to travel across the country, the freedom really with even the state of South Carolina or surrounding states, that you're able to go see a doctor. As long as they're listed as a Medicare doctor, you're able to go see them. Now, Part D option. So this is where we have a conversation that's interesting, is that it does provide flexibility in finding the right plan. So in my mom's case in particular, if anyone is familiar with some of the drugs that happen with any sort of transplant, she has some very specific drugs she has to take. Some are quite expensive, whether they're the anti-rejection drugs, whether they're steroids, or any of the other things that someone has to take because of that. She absolutely had to have the ability to shop different plans for the Part D side to be able to find a formulary that worked for her. In fact, I have to check on it every year for her to see what plan is going to work for her, to be sure that she's got what she needs. it's been fine. She's been able to do good, but having those options has been very, very important for her. So again, that's something to keep in mind, is that with a Medicare supplement, you are able to shop around for your Part D options. So for those of you that don't know, or just as a side note, if you are helping someone with Part D, if you travel to the website, medicare.gov, you can actually do a drug search. They have a drug search tool there where you can enter in someone's drugs, and it will actually go through and tell you who, as far as being the carrier, like what carrier would be best for that person. It'll show them what the drug cost is going to be, what the different pharmacy costs will be, and what their out-of-pocket cost will be. So it's an excellent little tool. So do keep that in mind as well. They did make a change last year. It doesn't work quite as good as it used to, in my opinion, but it still is a very, very handy tool. So keep that in mind. So I said we mentioned a cost example. I talked about my mom here for a second, but so this is just an example that we use. So if we're talking about a male who is 65 in Beaufort County, most popular plan being sold right now on the Medicare supplement side is a Plan G. It's the most comprehensive plan that's out there. And again, I'm not using this as a Blue Cross Blue Shield presentation, so we know there's a variance in price between the different carriers. You know, so let's say roughly that person's paying between $100 and $125 per month for their supplement. Now, every year that plan is going to go up. Now, that kind of varies by carrier a little bit. It can be anywhere from 1% to 4% increase in most cases. But they know that by paying that amount of premium, they know what they have covered. So the exposure level that's left to them on a supplement is your Part A. So like in my mom's case, she went in for surgery at MUSC. She was hit with a Part A bill afterwards, which is $1,408 for this year. Again, these numbers are going to be updated, soon for 2021. But as of right now, that number is $1,408. Now, right now, the Part B deductible is $198. Just had a kitten join me. Sorry about that. Part D varies, but does have certain caps on there. So there can be a little bit of variance on what the exposure is on Part D. So the actual catastrophic maximum on a Plan D for this year is $6,350. Now, I do want to point out that in my mom's case, you would think there's probably not a lot of conditions that are more serious than kidney failure. She has never actually hit the catastrophic maximum. So just keep that in mind when we're talking about that. Is there some exposure there? Absolutely. Could there be drugs that put you up at that level? Absolutely. But this is why it's very important to sit down and talk with our clients. So that's just a general exposure level. So, you know, for someone paying that $100 to $125 per month, they kind of know what their exposure is going to be if they have to go to the hospital. So again, we're not going to go through all these plans and go through letter by letter here, but these are kind of the different plans that are on the market right now. We're going to talk about Plan F in a little bit. That is kind of went away January 1st for new people turning 65. But again, if you want to take note of this, Plan G and Plan N are two plans that seem to be making some inroads this year on there for a selling point. So, and generally speaking, the rule is with Medicare Sup, if you start with the highest coverage, you can always work your way down lower to save some money per month. So just want to point that out on there for you. So now let's look at the Part C plans, which is Medicare Advantage, and take a look at some of the items on there that can really show where someone may lean to go this direction on here. So the Medicare Advantage, oftentimes you've got a lower premium, and this is compared to a Medicare supplement. So you have a lower premium plan, so it costs them less per month. So you may have that lower cost premium, but you may have a little bit higher exposure on your out-of-pocket. So right now for this year, for 2020, and I know this has been updated, but for 2020, that maximum out-of-pocket is $6,700 on a Medicare Advantage plan. So maybe your cost is a little bit lower. We'll look at an example here in a minute. Cost per month is lower, out-of-pocket to be a little bit higher. But again, it works very similar to a group and individual plan. So when people are coming off a group or individual plan, they kind of understand, like, okay, I have an individual deductible, I have a MOOP, I have a network I have to use, I have a physician's copay when I go in. That works very, very similar. So it is something people are very, very familiar with on there. And the other nice thing is with a Med Advantage plan is it takes some of the confusion out of Part D. So I use the example of my mom being able to shop around different plans. Well, some of the confusion actually is taken out on a Medicare Advantage plan because you've got a specific formulary that's right included in there on the Medicare Advantage. So keeps it easy. So it combines all the coverages into one. Now, I said I'd give an example here. So my father, he is 74. And when he turned 65, he did not talk to his son who enjoys selling Medicare. He decided to just go ahead and do what he wanted to do, as dads do sometimes. But he decided to go ahead and enroll in a Medicare Advantage plan. Now, for my dad, it made good sense because the one thing that he hates every month, and it's just the way he is, he holds everything really close to the chest as far as bills every month, is that he really wanted a lower premium plan. He did not want to have to pay a lot of money per month on there, which is fine. It's worked very well for him. He's been very healthy up until last year. So in the middle of open enrollment in November, now this is on the individual ACA side, he actually had to go into the hospital a couple of times for emergency services. He had actually, for the first time in his life, got a little sick, so he had to go in. So I told him kind of jokingly that, hey, next time Daddy gets sick, please, if you could do this in October or December, it'd be great, because November is a little bit busy for me. But that being said, it was he was okay and he was fine. But it was a little bit of an eye-opening experience for him because he actually did get some bills from the hospital that were much higher than what my mom pays. So he was asking me at that point, well, why am I getting these bills? So I walked him through his plan. He's with a Blue Cross Blue Shield Med Advantage. I did at least get that much from him. But we were able to go through, and I was able to explain him on there. So he has saved premiums. He still enjoys paying his lower cost premium plan right now, but it just understood that he has a little bit higher exposure when he goes to the hospital. But it's been a very good plan for him, and it's worked very well, covers his prescriptions that he is on. So just, again, if you're taking one thing away from these two slides talking about a Medicare supplement versus Med Advantage, is that there's a time and place for both. It's like the important thing is, as an agent, when we're talking about this and talking to our clients, is figuring out what their needs are. Well, what plan would work for them? What's their personality like? What are they wanting to do? And that'll tell us what plan they want to go into. So again, using here as an example, now this is not my father, but talking in Richland County, we know there's a lot of competition in Richland County, even over into Lexington in the Med Advantage market. You have plans that go anywhere from $0 to $75 a month. There could be some that are a little bit more expensive than that, but just for the sake of argument, we'll say $75. Copays on those plans can run from $0 to see a doctor up to $50 or a little bit more. Again, your maximum out of pocket is $6,700. Now, the one thing with Med Advantage is that there is a lot of variance by plan. So CMS kind of sets the parameters up of what needs to be covered, but you as the agent really need to be familiar with what plans you're selling with to know the ins and outs of those plans. So a $0 plan could be a very good plan for someone, but you need to know how those work when someone actually goes to the doctor or goes to the hospital. Vice versa, if you're on a $75 a month plan, but why is that plan even better than another plan that's $0? So we really need to pay attention, be able to explain the differences in companies between the two to be able to provide the right thing for clients. And then as well, drug costs are in there as well. So if there's one takeaway that you can get from this slide, and my encouragement would be for you on the MA side is to really do your homework, do your research, get to know your MA plans, talk to your marketing reps for the different companies, and find out what the real details are as you work with these Med Advantage plans to be sure that you're giving people and folks what they need. All right, so we're ready for a new poll question. That is the next spot we're going to. So poll question number 3, are you still with me? Which is a better plan, Medicare Supplement or Med Advantage? We'll give you a minute to answer these ones. This is probably a debate we could have unto ourselves for probably an hour because everyone's got personal preferences on these.
We have somebody in the chat said that's a trick question. And then another person said it depends on clients' needs. Seems to be a course here, so people are paying attention.
Yeah, very good, very good for both you people on there. Very good. That's exactly the right answers.
Yeah, keeps more people coming in and saying it depends on clients' needs. It depends. Feel free to pick one just so we have it for the polling part of it. So I see the part that you're saying it depends, but at least pick one of them right now, at least on the polling part of it.
Yeah, and I'll explain why I did this question in just a minute when everyone's done voting. So,
all right, we got about 74% of the votes in. I will also cross-reference based on the responses in the chat. So we will end the polling now. So the general consensus on the poll right now is 66% say Medicare Supplement, 34% say Med Advantage.
okay. Well, thank you for sharing that. I appreciate that. And yes, the person you put in there right off the bat, that's actually in my notes. So if you read my notes, I actually set this up to be a trick question. And the real answer to this question is that either one could be the proper one to put somebody in. It does depend. It depends on their finances, depends on their circumstances, depends on their financial situation and what their goals are. So I do apologize. This is kind of a trick question, but anybody who knows me, I kind of like to have some fun. So hopefully this got you thinking a little bit, going, what's this guy talking about? There's not one that's better. And that is true. That is 100% true. So thank you for participating in that one. So as we've talked about these two plans, let's go back and look at the key role agents play. So when we're talking about these two plans, going back to that question, we need to help clients make the right decision. So how many times have we met with a client where they have a stack of paperwork they've received in the past 6 months, where they've got letters from companies about Med Advantage, they've got letters from companies about Med Supplements, they've got letters from agents about wanting to help them, they've got postcards, they've got everything else, and they have no idea what to do. Because as far as they know, they've always been on a group plan. They've always been working, and they've had a group coverage on there where they know what's like, well, hey, I just pay, it comes out of my check, and then I've got coverage. Well, this is a decision they have to make, and the point is that they need help. So when they come in and see you, they're confused. In fact, if you see some of the paperwork and information that's sent to these folks, I can understand why they're confused. Some of it is not very clear. So when you're helping them make the right decision, we need to look at two things. We need to look at, well, what is their goal today? So they're 65, they're healthy, they maybe perhaps are still working. So maybe they're just exploring what's going to happen a couple of years down the road when they do retire. But we also need to ask them, well, what's going to happen tomorrow? What's going to happen down the road when maybe they're not so healthy? Unfortunately, all of us, as we get older, get sick. It just is, it's just the way life works. So we need to be sure that we're setting up for the right decision both today and tomorrow. So just some key questions here that we talk about, and you look at these, ask the right questions. You can think, well, gee, Matt, this isn't real detailed information. What, where, and how, and why? Well, the reason being is that each of those can have a specific response that helps us figure out what the client actually needs. See, what are they trying to do as they reach Medicare age? What is their financial situation are they in? Is their retirement funded? Are they still working? Do they have the funds needed if they do have some exposure on the health insurance side? When are they planning on retiring? How many people now that you know actually retire at 65? Many people now work all the way up till 70, 72 to get that the full Social Security benefit. So we know people are working a lot later now. Now, secondly, for those of you who work in the life insurance field, what have we seen recently? In the past 10 years or so, we've seen the tables change. Tables that used to stop at 100 are going out to 120 now. And why is that? Well, just a percentage note, and this is just a side statement, but I still find this statistic crazy, is that by percentage, the biggest growing percentage of population in the United States, and again, this is not overall numbers, but percentage, is over age 100. So think about that. We've got more people that are over age 100 living with us now than ever before. So as we're working with people trying to set up their retirement years, we know it can last a long time. So when they do plan on retiring, are they planning on traveling? Where are they planning on retiring? Perhaps you're meeting with somebody here in South Carolina that's retiring, but yet as soon as they retire, their plan is to move to another state. Maybe they're going to move to Florida or move out west. See, we just don't know, but we need to know, but this could dictate to us how we can help them with the Medicare coverage. Now, are they planning on traveling the world? That's another big question to ask, because if they're trying to travel the world, then we probably want to also set them up with a travel insurance plan. Do they plan on their lifestyle changing upon retirement? I mean, the golden dream right now for the United States is what? So that when you retire, that you can maintain the same lifestyle you've always had. Well, is that really going to be the case for every person that you meet? Is that going to be the situation they find themselves in? So these all lead up to a key three words here: need-based selling. So just from the question and answers you guys answered in the poll question, tells me your mindset is in the right place. We have to be able to have that conversation with them where we need to find out their needs. We need them to open up and talk to us. And that's going to take some skill on our part. We have to get them to talk to us so we can understand how to help them. And that's need-based selling. And that's really why we make this recommendation when it goes down to the why. It's like, well, based upon all the factors that you've given us, this is why I'm making this recommendation. So it's not that, hey, I just reviewed what commission I make the most on, and this would be the best thing for you. No, that's the absolute wrong way to approach Medicare. See, we're actually trying to partner with these folks and help them through there. And that by itself will lead to success in our sales. So that's we need to be specific in why we're making the recommendation. See, in my own family, I really see this clearly. My mom needed a supplement. It was perfect for her. It's worked out great for her. Could not be happier. But on the flip side, a Med Advantage has worked out perfect for my dad. He's actually really liked it, and it's been great for him since he's been on it now. He's been on it for almost 10 years. So it just really depends on the situation and the client, and not a one size fits all approach. But we really need to look at it for what works for that individual person. So that's kind of some interesting facts. I hope this is kind of helped just a little bit from a agent standpoint of what we can do to help them. It's just again, not to sound like I'm getting on a high horse here. So I apologize if I come across that way, but really that to me is the rewarding part of working with a Medicare client, is that you're helping them make one of the more important decisions, at least health insurance wise, that they'll make in their lifetime. And it's like, take the time to really do a good job with them. Take the time to show that you care. And that by itself will really lead to your success as an agent. In fact, the senior market in general is an interesting market to work in. With my position, I'm often asked a lot of times, well, what are the ways that I can expand my business into working with Medicare? What are the ways that I can get leads? Where do these leads come from? How can I be successful? And really, the senior market is the same way it has been for the past 25, 30 years, in my opinion. And that is referrals, referrals, referrals. So if you do a good job with someone, you make a couple happy with what you've done, you make a couple happy with how you've set them up, how you've talked to them. The seniors love to talk to each other. They will send referrals to you like you would not believe. I know some of my agents that are on this call, they will attest to that. It's referral-based business. So you get that person in the door, do a great job with them, and all of a sudden you'll get that snowball rolling. So just something to keep in mind. So when we talk about key role agents play, it's a great purpose to help people through these decisions. So let's talk just a little bit now about some of the Medicare updates that have happened in the past year. The first of which being, or really the main one I'm going to talk about, is really what happened January 1st of 2020 this year, and that was with MACRA. So I'm going to read this real quick, and then we're going to talk about this for a second. But we refer to it as MACRA, but it really stands for the Medicare Access and CHIP Reauthorization Act. Went into effect January 1st, 2020. So if you notice in red and underlining here, this means newly eligible enrollees cannot buy plans C, F, or F high deductible after January 1st, 2020. Plans D, G, and G high deductible replace plans C, F, and F high deductible. All other Medigap's plan remain unchanged. So that's a lot of letters in that slide. But let's talk about what this means. So we talk about a newly eligible enrollee. Well, in Medicare terms, what does that mean? Well, a newly eligible enrollee would be someone who's just turning 65 for the first time. So what really changed January 1st that you're going to see the most, there's some other factors in there, but really from a day-to-day sales standpoint, what changed the most is that if you've got someone who turned 65 after January 1st, 2020, so let's say the birthday is September 1st, 2020, they would not be able to buy a plan C, F, or F high deductible. The best plan they would have available from a coverage standpoint would be a plan G, but they could also enroll in plan G high deductible or a plan D. So again, you've got someone turning 65. That's the first time they've been eligible for Medicare. They turned 65 after January 1st of this year. Then the best plans, or the best plan on the market they'd have available to them would be a G, a D, or a G high deductible. Those would be the plans they would and I hate to use the word best, I keep saying that, but I don't mean best, but that would be the plans that are available. Those folks would not be available to purchase a Plan F. And that's the whole point. Plan F has been the most popular plan on the market for many, many years going into this. In fact, on a side note, you know, we're here rolling into almost October, and by far and away, our two best-selling plans at Blue Cross are Plan G, which makes sense. People turning 65, they're buying a Plan G. They want the best they can get. But our second most popular plan is still Plan F. Well, how can those people still buy a Plan F? Well, let's take a look at that. So this is what happened with our Plan F. There's been some misconceptions. There's been some mistruths, if you will, that have been going on in the market, and that is that Plan F is going away, will not be available for anyone after January 1st, 2020. This is not true. So consumers who turn 65 or older before January 1st, 2020 can enroll in the Plan F if it is available to buy on the market. So let's say you got someone who turned 65 back in 2018. They are just now retiring. Would they be eligible for Plan F? Absolutely. You have to find a carrier that's still selling it, but they would be eligible to buy it. They're grandfathered in. So the second part of that is somebody who is on a Plan F can keep it. There's no action going to be required. Those plans are not going away. They can stay on those plans. So just a couple points to bring out. There's been some confusion on that. In fact, this information was taken off a bulletin the DOI released last year because we had, if you notice the second line there, policyholders are being told, well, it's not that line, but they were being told that their Plan F was going away, and were being asked to move over to a different plan or a different company, kind of unscrupulous companies that were out there trying to tell people that their Plan F was going away and trying to make them move companies. So that is not true. You can keep your Plan F. That's on there. The second portion that was on there that people were being scared about is that Plan F premiums will drastically increase after January 1st, 2020. So far, we have not seen that in the market. The argument is that if you got no new people coming into a plan, then that will eventually lead to that plan going up in price. And that could be the case, but that's not something that's going to happen overnight. So just keep that in mind when you're working with customers that are on an F. They can keep those plans in place. They do not need to do anything. Again, talking about my mom, she's staying on a Plan F. I'm not moving her. So when somebody's making these statements to folks that don't understand what's going on, they are considered false or misleading to induce consumers to improperly switch coverage. And it's a clear violation of Medigap insurance laws. So as we talk about trying to have a good reputation and try and do a good job for customers, this would not be the way to do it, to tell them wrong information. So again, I just want to put this back into a nutshell here. So if you're working in the market today, if you have someone that turns 65 before January 1st, 2020, they can take out a Plan F. That birth date is the key. So if they turn 65 before January 1st, 2020, they can enroll in a Plan F. The only caveat being there has to be a carrier that's selling that plan for them to enroll in. So anybody who turned 65 after January 1st, 2020, well, then the best plan they can get on the market, or the most comprehensive plan they can get on the market, is the Plan G. And just on a side note, the only difference between a Plan G and a Plan F is that $198 Part B deductible. So that is what they would have to pay when they go to go see the physician. But other than that, it's essentially the same plan. So just keep that in mind. So hopefully that made that clear. We do get quite a few questions on that. So secondly, future changes. Well, as we know right now, there's a lot of political unrest across the country. For those of us that have been in the health insurance industry, no doubt we have seen many changes over the past 7 to 10 years inside the industry. We know we're all kind of learning. It seems like stuff changes on a day-by-day basis. But the current political climate in regards to Medicare has really been pretty stable. There's been a few little tweaks here or there, but it really has not changed the fundamental process of Medicare. We hear a lot of terms of Medicare for all and so on, but really those things have not affected the seniors that are turning 65 and getting Medicare. With 10,000 plus Americans a day qualifying for it, that's a big voting base, and right now there's just not a lot of urge to change things inside the Medicare industry. However, I would definitely recommend staying as close as you can to organizations like NAIFA. so you can stay abreast of industry news. Keep your ears out there with the health insurance, with the changes that happen. Really, pay attention to what's going on in our marketplace, and keep abreast of everything. So lastly, I promised I wouldn't make this all about Blue Cross Blue Shield of South Carolina, but I did want to mention my company because, quite frankly, it was in the filing, so I have to at least mention it with the state. But I'm very proud to work for Blue Cross Blue Shield. The big three things we normally promote are trust, stability, and service. We are a trusted brand in the state. People know that Cross and Shield. We're an A+ rated company located here in South Carolina, and that feeds right into service. I'm relatively new to the state. I've only been here for about 6 years. And the one thing I've noticed is that wherever you're at in the state, it seems about to be the furthest you can get away is about a 2.5-hour drive to get to Columbia. So if that's the case, and you got somebody who really needs to talk to somebody and sit down with somebody in person, our headquarters is about at the most 2.5 hours away, which is really a nice thing. Secondly, about 95% of our customer service calls are handled the first time. That's something we've been pushing for very, very much. To try and get that one call resolution. And that is definitely the case that we are going. So we definitely appreciate that. But then a couple other points I wanted to bring out. And one of the words that maybe we don't often hear with Blue Cross Blue Shield, and that is innovation. So our Med Advantage product this year, we're entering 4 new counties. For those of you that ever worked at Blue Choice and are familiar with the comprehensive copay, that's very similar to how our Med Advantage product is working. So please take a look at that this year. And we're rolling out a $0 premium plan in some counties. So I think our Med Advantage product is going to be really, really great this year. So please take a look at that. And secondly, on the Medicare supplement side, I wanted to mention that we have been the #1 Medicare supplement carrier in growth the past 2 years. So very proud of that. For those of you agents on here that I work with, or for those agents that I wanted to get out starting to sell, we really can't thank you enough for the growth that we've seen. People may jokingly say, well, of course you're #1. Well, for a few years, we were not the #1 carrier in med supplements. So between a lot of hard work that you guys have put in the field there, we really greatly appreciate it. And then lastly, we are rolling out a new feature. There's only a couple carriers in the country that even offer this on our supplements, but that is a plus endorsement, available as 1-1. And again, that's going to help members by getting this. They can get 5 exciting services for medical transportation, a new hearing aid benefit through True Hearing, an enhanced Silver and Fit program, a vision endorsement for glasses, and then there's also money available for over-the-counter health items. So I promise as much time as I'll spend pushing Blue Cross, but I think this is going to be a really good year for us. And according to my clock here, that puts me about 53 minutes. So I appreciate everyone's attention, and hopefully we've had a good discussion here this morning. Please let me know any questions or answers you have, and I will open that up for questions and answers. So Arden, do we have any questions or answers do you have any questions that have come in that I can answer?
Yes, Matt, thank you. So the first one comes from David Grookett. When a very high earner quits or retires and income drops, is he stuck with the high premium for 2 years until the lower income catches up? Or is there any type of appeal or adjustment that can be done?
It will adjust as the years go by, but he is going to be in that bracket until that drops.
All right. Joe Riley did ask for the course number, but I'm sure we'll provide that afterwards. That's not a problem. We'll have that at the conclusion. Do we have any other questions? I know there was a comment earlier. Thoughts and prayers are with your mom. Somebody did put that in the chat.
Oh, well, I will say I use my parents as an example. Thank you for asking that. I will say this. I appreciate that. And secondly, she's doing great. The transplant went fantastic. She is doing very, very well. And, probably her getting that transplant has added a good 10 to 15 years onto her life. So thank you for asking that. Yeah, she has done very, very well. So thank you for that. I appreciate that.
We have, let's see, Aubrey said, with some luck with clients appealing the income with Social Security, but it was up to Social Security to review the higher income versus Part B premiums, and the exceptions were pretty rare. Just
Yes.
a comment.
Yep.
And then just overall, people are just saying it's a great job. They enjoyed the presentation, Matt. That was kind of what we have. Do we have any other questions that we want to post in the chat or in the question and answer sections from Matt before we relieve him of duty? Let's see, here we go. We have another one. Any suggestions on how to handle Part D drugs for those that are confined multiple days in the hospital and claim is filed as outpatient?
That's one I may not have time to answer. That is one. So somebody's trapped in a hospital, or not trapped. That sounds horrible. If somebody is in the hospital and they're receiving drugs while in the hospital, it's very important how those drugs are filed. So because depending where a drug is administered, can actually end up falling under a Part B or Part A coverage instead of going against the Part D. So what you need to do in case somebody's getting charged for drugs while they're in the hospital, they need to file an appeal with their current carrier, whether that's a Med Advantage or a supplement, and explain to them the situation, and it should be able to get resolved. In fact, I will say this on a side note. I've had a few of those situations I've worked on in the past 3 or 4 months, and those are a pain to work with. But you need to contact the actual carrier of the supplement or the Advantage to help with that situation.
All right, thank you. And then Stephanie would like to know if we're going to get a PDF of this presentation. Are you able to share that with us, Matt?
I have to double check on that because this is a CE credited class. I'm not sure if I can share that or not, but if you contact me, I may be able to send one to you that is not necessarily the PowerPoint. But I think you're recording this anyway, so they should be able to watch it again.
Correct. We are recording this and it will be posted to the NAIFA South Carolina website. Johnny Craven wants to know what options are available to help a client once they reach the gap for meds.
The gap on what? I'm sorry.
The gap for meds.
The old donut hole question. So there's been some changes recently on there. So if someone reaches the donut hole provision, one of the things that changed last year was that if you actually work with the client or the client reaches out to the specific drug maker, and by some chance the drug maker actually provides like a discount coupon or like a discount towards the drugs, you know, that can be upwards of a pretty good amount of money, 50, 60, 70%, you know, off. The donut hole provision will actually, so the client pays their portion, but the portion that's actually paid by the pharmaceutical company will continue to count towards the donut hole area, which was a pretty, I want to say it was 2019, beginning of the year, there was a change that was made. It might be the end of 2018. But if you've got a person in that, be sure they contact, just take one takeaway. You got somebody in the donut hole, have them contact the actual drug manufacturer and see if they can get a coupon or discount code, because that may actually really help them get through that donut hole a lot quicker.
All right. All right, it doesn't look like there's any other questions. Joe, I see your comment. That's great. Thank you. That will not be an issue. If your internet went out because of Comcast on the Charleston area, you guys will still get credit since you were answering the questions.
Perfect. And again, just want to reiterate, thank you guys so much for having me. I greatly enjoyed it. And please feel free to, you know, reach out to me or reach out through NAIFA, and be more than happy to help out any further questions or anything.
All right. Thank you, Matt. And then Mr. Lloyd.